University Católica de Santiago de Guayaquil, Facultad de Ciencias Médicas, Carrera de Enfermería, San Vicente de Paul. Subject English Technical Topic: Anesthesia and Developed Brain Implication of the FDA Warning. Student Tatiana Espinosa, Teacher Clesen John Moscoso, Sexo Cycle 8. FDA warning for the Drug Administration. The FDA has issued warning readily used to general anesthetic and sedation drugs in the children under 3 years of age and the pregnant woman in the childhood first trimester.
Surprising the medical community, the U.S. Food and Drug Administration last week warned general anesthesia or sedation drugs used repeatedly in children younger than 3 or during a surgery lasting 3 hours or more may negatively impact brain development. This warning also applies to pregnant women in their 3rd trimester. Here with the story is WSJ reporter Sumathi Reddy and Dr. David Warner, a pediatric anesthesiologist at the Mayo Clinic in Rochester, Minnesota. Welcome to both of you. Sumathi, let me start with you. There have long been concerns about general anesthesia in toddlers and babies, but are these new warnings from the FDA based on any specific new studies?
Well, they reviewed the whole body of evidence.
Okay.
And the good news from the warning is that they did say that sort of brief, short exposure to general anesthesia are not, you don't have to be concerned about that. So there have been several recent studies in the past year that have shown that.
Okay, so Dr. Warner, this also means, though, that there will now be FDA warnings added to the labels of 11 general anesthetic and sedation drugs. That can be alarming to parents. So did you see this coming at this moment?
I don't think we anticipated the exact timing of this, but I think that most of us in the field have recognized that the evidence has been accumulating, and so it's not surprising that...
Or a sedation drug of that level.
So the estimate from the FDA is about 1 million. Under the age of 4 are getting in.
FDA. The enhanced also in the two medication sulfate warning do inform healthcare providers, the parents, and the caregivers of the potential asset her nursing care is involving in the third care.
On Wednesday, the FDA, Food and Drug Administration, issued a warning for expectant mothers and children under 3 years of age. Repetitive or long-term use of general anesthesia or other sedation drugs for longer than 3 hours could be harmful to the developing brain of a fetus or child. In an agency news release, Dr. Janet Woodcock said, "We recognize that in many cases these exposures may be medically necessary, and these new data regarding the potential harms must be carefully weighed against the risk of not performing a specific medical procedure." Dr. Woodcock hopes the new insight will help patients and physicians make informed decisions surrounding medical procedures.
The clinical data were considered more difficult to interpret. Study of rice sample exposure for relatively minor procedure has been reassuring. The lobster adverse neurodevelopmental effect has been observed after prolonged or repeated anesthesia. Administration are difficult to interpret because of secondary by indication.
postoperative cognitive dysfunction. And it's an area that we've been investigating post-anesthesia and surgery for the last more than 15 years. So the work that we've been doing is looking at patients who are having both non-cardiac and cardiac surgery and even light sedation. And what we see is that at about 3 months.
In the conclusion, Perry and the caregivers discuted whether their children had professional the potential adverse effects of anesthesia on brain development at the will and depending on the procedure. These may be developed without endangering the health of their children. Thank you.